Shailendra, you can start now.
Okay, Doctor Saab. So, on the behalf of Ross Diabetes Care, I would like to welcome Dr. Brij Mohan Makkar with Dr. Kirti Suda. And Dr. Saab, I would like to introduce Dr. B.M. Makkar. वैसे तो everybody is knowing about him, but just an intro. Dr. Brij Mohan Makkar is a senior diabetes and bariatric physician and director of Dr. Makkar's Diabetes and Obesity Center at New Delhi. And Dr. Makkar is center is the only EASO COM European Association for Study of Obesity accredited center for obesity management in India, and he is a fellow of Indian College of Physicians, Royal College of Physicians, American College of Physicians, American College of Endocrinology, and Research Society of the Study of Diabetes in India. Dr. Metzger is actively involved with the diabetes and obesity societies and has served RSSDI for more than a decade as a EC member, treasurer, and honorable secretary for of RSSDI. He's also served RSSDI in past as treasurer, honorable secretary, and chairman of RSSDI Delhi chapter. Currently, Dr. Makkad is a member of the executive board of Diabetes India and a co-opted executive member of RSSDI national body. And secondly, I would like to introduce Dr. Kirti Suta. She is the mastermind behind this educational program, and I would like to welcome her on the behalf of Ross Diabetes Care. And so now I am handing over this session to Dr. B.M. Makkar, and the topic for this session is let's talk diabetes, how to deal with the diabetes for the patient. So, Dr. Makkar, please go ahead.
Thank you, Shailendra. Good afternoon, everyone who have joined this Zoom link or who are on the Facebook page live right now with us. Uh, as you know now that today there is a change in the format that we are doing. Today's program is supported by educational grant from Roche, who are also actively involved in promoting education for diabetes, and they also make one of the best glucometers which is available worldwide. Uh, with this, I am going to share a presentation and take you through this presentation slowly, trying to give you all the key points of diabetes understanding and diabetes management. And as Shailendra just told you that topic for today's discussion is let's talk diabetes. So we are going to talk about diabetes only, and I will try to touch all the points in a very simplified format. After that, if you have any questions, everybody is welcome to ask questions. So we all know, diabetes is a major healthcare challenge globally. India is also not spared. India has a huge population of diabetes, currently touching about 8 crores. The bigger problem is that of this 8 crores, almost 4.5 crores are undiagnosed diabetes. That means these patients don't even know that they have diabetes. So there is a good chance of delayed diagnosis of diabetes, which predisposes to increased risk of complications. And that is why almost 25% of the patients or persons who are diagnosed diabetes uh, are found to have complications right at the time of beginning of at the time of first diagnosis. Now, in this today's discussion, I will touch upon the overview about diabetes. Briefly, how we use self-monitoring of blood glucose in diabetes management. How are good, glucose meters like AccuCheck blood glucose monitoring systems important in achieving good glycemic control or good glucose control and achieving targets of diabetes care that are recommended by various international societies, and then we will have some question answers. So, what is diabetes basically? So diabetes we know is the hallmark feature is increase in blood glucose levels. So what is glucose? Glucose is nothing but fuel which provides energy for various functions of bodily tissues and cells and maintains gives them enough energy to maintain normal functioning and normal structure. So glucose is the source of fuel or energy in the body, and to utilize glucose we need a hormone produced by pancreas. It is called insulin. So if we don't have insulin, this glucose cannot be utilized as uh, energy by any tissue or cell. Now, what happens? Whatever we eat in terms of food, it gets converted directly or indirectly into glucose or sugar, which is source of energy. This sugar enters blood. Now, if we don't have insulin, then this sugar cannot be taken up from blood by the various tissues to utilize this as source of energy. And thereby we need insulin for utilization of glucose. So once we have insulin or adequate amount of insulin, then this glucose gets utilized by various cells as source of energy, and the amount of blood glucose or glucose in the blood stays constant in the normal range, because whatever increase is happening, it is taken up by glucose various cells to utilize as energy. Now, what happens in diabetes and what are the different types of diabetes? So one is there can be deficiency of insulin. So insulin is not available. It is not produced by the pancreas. And this usually happens because of the acute damage to pancreas, which leads to a decrease or almost total deficiency of insulin. And this leads to type 1 diabetes. So type 1 diabetes is caused by near total deficiency of insulin due to damage to the pancreatic beta cells which produce insulin. Uh, can you keep your mics on mute? Dr. Anwar, I think your mic is on. So please mute your mic. So then there is a situation where the insulin deficiency can be partial. So there is insulin resistance as well as there is insulin deficiency. And as long as this deficiency is, not able, this deficiency is able to still manage the degree of insulin resistance, the sugar levels don't increase. But what happens is that there is a situation where the insulin is not sufficient to take care of the insulin resistance and the glucose starts rising. So this is type 2 diabetes, where there is not just deficiency of insulin, there is also increased resistance to insulin action. So whatever insulin is there in body, it is not working efficiently. And third, I will touch upon the important part is the gestational diabetes that occurs during pregnancy. And again, it is due to inefficient utilization of insulin, which leads to the diabetes state in pregnancy. And there is deficiency as well as decreased inefficient utilization of insulin. Now, what leads to these various types of diabetes? There are other types of diabetes also which are caused by damage to pancreas or part of other endocrine disorders, which we are not touching up in this presentation, just to keep it simple. So what leads to diabetes? So there are various risk factors which predispose to onset of diabetes. One of the strongest factors is the family history of diabetes. Somebody has family history of diabetes in family, it is a strong risk factor for development of type 2 diabetes. So if one parent is diabetic, almost 60% chances of getting diabetes. If both parents are diabetic, almost 90% chances of getting diabetes. Then overweight is a major risk factor for developing type 2 diabetes. And this is one of the key drivers why we are seeing so much increase in type 2 diabetes globally, because there is increase in prevalence of obesity which is happening worldwide. Third is lack of physical activity. So lack of physical activity is an independent risk factor for increasing the risk for developing diabetes. A person may not be overweight, but if the person is very inactive, then chances of getting diabetes go up. Then, of course, unhealthy eating patterns and overweight and obesity. And one of the factors is old age. Another important factor in India is the Indian ethnicity. We Asian Indians, we have a body phenotype which is marked by higher quantity of fat in the body as compared to our Western or Caucasian counterparts. And this predisposes us to higher risk of developing diabetes. So Indians per se, by if you are Indian, your chances of getting diabetes are 20% higher as compared to other people in the Western population. Now, what are the common symptoms? We all know, there is an increased thirst. I would request everyone to please mute their mics because there is a lot of noise here. Amit, can you mute your mic? So there is increased thirst, there is weight loss. The four cardinal features of which are hallmark of type 2 diabetes or diabetes are increased thirst or polydipsia, increased urination or polyuria, increased hunger or polyphagia, and weight loss. So these four are key features which lead to an indication that possibly this person has diabetes. And of course, then there is increased weakness, lethargy, all these factors which should indicate that this person may be having diabetes. Now, since in Indian population we get diabetes almost 10 years earlier as compared to Western population, and we are a high risk ethnicity. We have high risk of getting diabetes. That is why it is recommended that at every single opportunity that you have to visit a doctor, you must get your sugar checked. So opportunistic screening, so called, that whenever there is opportunity for a healthcare visit, you should get your sugar checked, is important way of diagnosing diabetes early. Now, why it is important to diagnose diabetes early and manage it early? Because diabetes per se, if you have high sugar level, maybe you don't have any problem uh, apparently. But as long as the sugar levels are staying high in blood, they are, you know, uh, you have to understand that sugar is high in blood. The blood is going to every part of body to provide nutrition. So every single tissue and cell is exposed to high levels of blood sugar. And because of this exposure to high levels of blood sugar, there is an ongoing damage, which goes on increasing slowly. And at certain point of time, there is a break point and you will see the visible complications. And high sugar levels in long run lead to a major or significant damage to all blood vessels and all nerves of body. In specifically, there are certain microvascular or macrovascular complications. So there is diabetes specific complications include retinopathy or damage to the retina of eye, nephropathy or damage to the kidneys leading to kidney failure and a need for renal transplants, uh, uh, damage to the blood vessels leading to diabetic foot, damage to nerves leading to diabetic neuropathy, and of course the increased risk of cardiovascular disease. And there is increased risk of heart attacks, increased risk of strokes, and so on. Just to tell you that diabetes in diabetes patients, type 2 diabetes patients particularly, 75% of the patients die of cardiac complications. They don't die of sugar, they die of cardiac complications. So we have to focus on risk in decreasing the risk of cardiac complications, and diabetes is considered as cardiovascular risk equivalent. That means it gives you risk equal to one heart attack if you get diabetes. So it can lead to heart problems, kidney failure, eye problems, and foot problems, and so on. And issue is now how we manage. So there are four major aspects of management of diabetes. We know lifestyle interventions are important. We know that moderation of diet and healthy eating habits are important. In addition, everybody should be given medication or should receive medication as per the requirements or of that individual based on what stage of diabetes is there. Now, lifestyle interventions, diet modifications, and medication of course, cornerstones of diabetes management. But with this, how do you know whether you are managing right or wrong, or how effective is your management strategy? To do that, we need to see the sugar levels. And can you send the patient to check sugar levels repeatedly to the laboratories? The answer is no. So there is a huge role of self-monitored blood glucose or self-monitoring of blood glucose in proper management of diabetes. And if you are putting in lifestyle interventions, dietary modifications, and medication, taking all the medications, but you are not checking sugars regularly, which happens in most of the cases in India, then your diabetes management can never be good. And good chances that either you will be on the lower side of the range or the higher side of range, or having high sugar without knowing it and moving towards complications. Now, it is recommended by various societies that we should target a blood glucose level of fasting between the range of 80 to 130, but preferably less than 120 or 110 for most of the patients without causing hypoglycemia or low sugar levels, which is defined as sugar levels going below 70. After meals, preferably the sugar level should be less than 140, but maximum 180 is the limit that you should not be crossing. And A1C should be preferably less than 7%, preferably less than 6.5%, but in general less than 7% for all patients to avoid the increased risk of complications. So if your fasting sugar is more than 120 persistently, postprandial is more than 180, or A1C is more than 7%, it is, you can assume that you are moving towards complications and you need to correct it or control it fast. Now, the challenge in management is, as I mentioned, it is very difficult to detect high or low sugars unless you are monitoring. So person has to keep checking sugar on regular basis to see whether they are going low or they are high. There is, if the person has, if it is a lady who has gestational diabetes, a very strict control of glucose levels is must to have good outcome of pregnancy, to have a normal weight baby with a normal delivery. You must have very good control of diabetes, and to do that, we have to make sure that sugar control is very strict, and recommended level is in the range of 90 for the fasting and less than 120 for the pp levels. And to do that, you have to keep checking sugar at least 4 times every day. Then regular testing is also important to keep the sugar under control and avoid complications. And to do that, we know, I just mentioned, we need to self-monitor blood glucose. So what is self-monitoring of blood glucose? Self-monitoring of blood glucose refers to blood glucose testing at home by patient himself or the care provider of the patient. The aim of self-monitored blood glucose testing is to collect information about blood sugar levels at different points of time and identify the fluctuations in blood glucose levels or the highs and lows at the sugar levels. And they are important. Unless we know them, we can't treat sugar properly. Number of clinical trials have shown that SMBG is very effective in improving the blood glucose control and reducing the risk of complications in all patients with diabetes, whether it is type 2 diabetes or type 1 diabetes, or it is gestational diabetes and so on. So regular self-monitoring of blood glucose is very important, and it helps you in deciding what to eat, because once you have eaten something and you check your sugar, you can know whether this food is good for me or this amount of food is good for me. You can also, evaluate your exercise levels, how effective they are. You can also diagnose low sugar levels. Whenever you have symptoms, you have to check your sugar and find out if you are going low. And you can also adjust your own medications based on the testing of glucose. Now, to be effective and useful, testing has to be done on certain pre-defined points. Then only you can decide whether your sugar values, how will your change of medications, how it is going to change your sugar values. If you are just looking at random values, they don't help you in deciding much. And if you are looking at random values, which is done once a week or once in 10 days, it carries no meaning, because you don't know whether your sugar values are same on day-to-day basis on those particular time points. So it has to be a structured testing with to be beneficial. Now, if you are able to use blood glucose testing properly, you can have good control of diabetes and definitely reduce the risk of complications. Now, another important thing is there is always, patient will come and tell, sir, I have heard that glucometers are not accurate and lab testing gets better. So I go to lab and get tested for fasting and PP. Now, first thing is you must understand that what is fasting. Fasting is a glucose level done in the fasting state, which is more than 8 hours from the last meal. That is considered fasting. And PP value is postprandial, which means after meal or post meal value, which is measured 1.5 to 2 hours after meal. Now, in Indian setting, the PP value is considered post breakfast value. But to make the understanding clear here, all post meal values which are measured between 1.5 to 2 hours after a meal are PP values. And it is not just post breakfast that you have to control. You have to make sure your post lunch sugar levels are also in target range. You have to make sure post dinner values are also in target range. So you need to test at multiple time points. Now, SMBG is the most, possibly, I wouldn't say the most, but it is an accurate method for monitoring blood glucose. Why we never tell our patients to visit lab for getting a sugar tested, because you can get it tested, say fasting or post breakfast. What happens in emergency? Are you going to send the patient to lab? Or you are sitting at home, you are feeling uncomfortable in the middle of night, can you run to lab and get your sugar levels? You have to depend on glucometers, and that is why getting a good glucose meter and using it regularly is very important in managing diabetes properly. The advantages of SMBG are that it gives you instant result. Lab will give you a result in 2 hours, maybe 4 hours, maybe by evening. It can be done at home. You don't need to run to any facility. It can be done any point of time. You have your glucose meter. You can do it in 1 minute. You don't need time. You don't need facilities. It is economical. This trip may sound expensive, but actual cost of every test is less than 20% of the lab test, and it can be done 24/7 any of day of the time. Now, it can be used to provide immediate glucose results. It can help in understanding the disease profile better. It can tell you whether you are in the target range or no. It can empowers you to manage your diabetes. You can make changes in your diet, exercise, make minor changes in your treatment also, and it certainly helps in reducing the risk of hypoglycemia or low sugar levels. Now, to take a full advantage, as I mentioned, you have to do it in a structured manner. You have to collect data on the appropriate time points, recognize the readings that are going outside the target range, and I have already told you the target range. You have to act to make changes in terms of diet or exercise or medication, or consult doctor based on the readings that you are seeing. And you must compile the periodic glucose profile by taking series of measurements. One measurement is never enough. And now with the meters like AccuCheck meter, which is shown here in the picture, there are 2 meters which you can actually they connect wirelessly with the app which is loaded in your phone, and you can interpret a lot of data from that. This is a table which is a consensus from the Research Society for Study of Diabetes in India, and I was actively involved in defining how much and when sugar testing should be done in different types of patients. So there is no one formula which fits every diabetes patient. Depending on how severe is your hyperglycemia or the sugar levels, how long you have been diabetic, what are the other conditions, how much are your fluctuations, whether you are on oral drugs or insulin. There are different recommendations for different set of people. So patients who are type 1 diabetes, that means they are insulin deficient, and they have to be treated with insulin, which is to be injected ideally 4 times a day. The adults should be testing their sugar 2 to 8 times every day, and children also should be testing their sugar at least 4 times a day to make sure that their fasting, their post meal sugars are not going very high, and at the same time, they are not going into low sugars. Now, if you look at the patients with type 2 diabetes, those who are treated with oral agents, that means the tablets or capsules, they should be testing at least 4 tests per week, which should, out of which at least one is fasting and three are post meal values after three different meals. Now, this is for people who are controlled, well controlled. Those who are, initiated on treatment or their treatment is being adjusted, they need to check daily or alternate days for a few days till they get controlled, and then they can be switched into less frequent monitoring. But if the person is on insulin or insulin plus oral agents, they should be testing all these values at least 3 to 4 days a week, if not every day. Similarly, patients who have gestational diabetes, as I mentioned earlier, they need to check their sugar at least 4 times a day, at least 4 times a day throughout the pregnancy to make sure all their values are on target. Now, so it depending on the situation and the type of diabetes and the degree of glucose levels, one may be advised to check sugars before meals or after meals, or when they are suspecting a low sugar level, or at bedtime. Definitely, one thing which is not usually advised to most of the patients is that prior to any critical task, where if the sugars go low, can lead to a accidental or a risk of life, they must check their sugar before that task. And one of these common tasks that we perform on daily basis is the driving. So ideally, all patients with type 2 diabetes or diabetes should check their sugar before they start driving. And they should make sure that they are carrying some sugar or glucose with them when they are driving. If they have any problem during driving, the first reaction should be to take the vehicle away from the road to the side and stop there. If they can check sugar, fine. Otherwise, the first thing they should do is to drink something sweet or some soft drink, or eat 4 spoons of sugar or glucose with a glass of water. And if they are not better in next 15-20 minutes, they can repeat it, or they can ask for medical help. Everybody who goes out for drive must check sugar on daily basis to avoid that risk of accident. So, as I mentioned, this is a Roche sponsored or a Roche supported activity today, and they have very good glucometer systems which help in achieving target control, and their meters are good. Whenever we are talking of glucose control or glucose monitoring, it is very important to buy glucometers which are standardized, which are up to the recommendations that are given by government to maintain good quality, and they should be cheap also, and they should be good with the technology component. So if you have to have good monitoring, accuracy of blood glucose plays very important role. And there are certain ISO standards. The latest standard is ISO 15197 2013, and worldwide all these glucose meters must be compliant with this ISO 2013 standard, which shows a very good accuracy. In addition, these meters are also connected from with an app called My Sugar, and they feed this information to the app, which can give you further analytics that how much has been your average sugar, how much have been deviations in your sugar level, how much have been the episodes of low or high blood sugar during a particular period. And you can download these data and have a printout, or share the data with your treating physicians, and you can have a visual appearance for yourself that all these values in green are good, all these values are in red are not good, and you have to correct that. So they are managing, these meters or the self monitoring is very important in managing diabetes. In addition, you can, use the helpline to take support for your diabetes education part or understanding diabetes from these companies. With this, I think I will end my presentation, and I am ready for any questions if anybody has. I can see quite a few people have joined on our Zoom link also. And Dr. Kirti, you are.
Sir, I have few questions, but I was waiting from the Zoom link contacts. If they want to ask their questions, they can proceed
Yes,
first.
we can have questions.
Dr. Sab, I would like to ask one question. Earlier, Government of India have considered blood glucose monitoring as a fifth vital sign.
It is, we have proposed that. In fact, I am one of the members in the committee who have proposed to consider the blood sugar as fifth vital sign, but Government of India has not approved this as yet. But it is very important, as I mentioned, that for every single healthcare visit, you must get your sugar checked.
And we all will agree that there are so many, more than I think out of 10 there are 4 5 patients might be have diabetes, but they are not knowing it.
More than 5. 55%
More,
people do not know diabetes.
yeah.
Do not
So
know.
in that case, if we do random testing or we do the like BP की जैसे testing करते हैं, अगर हम we are doing the same kind of
So
practice
that
with
is
the
why
blood sugar.
opportunistic screening is recommended. That is why we
Yeah.
recommend opportunistic screening.
Thank you, doctor.
Sir, can I take a question?
Yes, why not?
So one question is, my fasting blood glucose is always more than the PP.
So it depends on, in patient to patient, and also it depends on what kind of medication you are on, what is your eating pattern, what is your exercise pattern. So many things can influence this. But it is not uncommon to see blood sugar values where fasting is more than the PP value, and all that is required is to change the treatment strategy a bit, and it can be, put in order. But if the difference is like 5 or 10, it does not really matter. If somebody has a fasting or 110 and PP is 100 or 105, it does not really matter. But treatment needs to be, modified, and one should consult the physician for this, and they will change the medication required.
Another question which has come is, what should be the daily routine of a diabetic patient?
Very vague question and very broad question. So we can have next session on this. What could be routine? So routine has to be, you should have a healthy lifestyle. As I mentioned that, once everybody should perform a physical activity equal to 45 minutes of moderate vigorous physical activity, as it is called MBPA, which is equal to 45 minutes of brisk walking or cycling or swimming. One can do it in splits, one can do it in one go. In addition, you should have a healthy eating habit. Avoid all free carbs, avoid all fats, take proper meal that is recommended by dietitian in terms of the calorie count. Eat regularly, eat on time, don't overeat, and don't miss your meals. These are important, basic things one has to keep in mind when somebody has diabetes.
Another question which has come is, how to reverse COVID-induced diabetes, which is persisting despite lifestyle changes and hovering just above pre-diabetes, A1C around 6.4 for a 55 years individual, precipitated for the first time during severe COVID.
So there are various factors which need to be considered in defining what is COVID-induced diabetes. So if this person is new detected diabetes post-COVID is overweight or obese and has features of type 2 diabetes and does not have significant insulin deficiency, which can be, assessed based on the patient profile, and patient is overweight and obese, certainly we can look at, aggressive lifestyle interventions to induce remission of diabetes. But if somebody has got diabetes, where we are getting now data that COVID virus can directly damage beta cell of pancreas, it is unlikely that we can reverse this. And these patients may be well controlled on oral agents and may require insulin also in addition to oral agents.
Another question which has come from the Zoom link invite is, what should be the ideal SMBG frequency if my blood sugar is controlled?
So it depends on whether you are controlled on oral agents or insulin. So if you are controlled on oral agents and you are not taking any sulfonylureas, a 4-time testing during week is good enough, 1 fasting and 3 post-meal values. You can do it in a staggered manner. You can do it alternate day, or you can do 4 days time, and then next 4 days you don't test. But if you are on insulin, at least 3 to 4 times, 4 days a week, you should check the full profile.
Another very important question which has come is, what difference will it make if my blood sugars are left high?
It will lead to a slowly progressive damage to all the structures, specifically nerves, microvasculature and macrovasculature, and ultimately lead to diabetes or hyperglycemia mediated damage, leading to all microvascular complications like nephropathy or kidney disease, neuropathy or foot disease, or retinopathy, like loss of vision or blurring of vision, and ultimately lead to long-term complications which can be crippling. See, it is not that somebody can die of diabetes. The worst is somebody can get a crippled quality of life, end up in an end-stage kidney disease, beyond dialysis, beyond transplant, but the quality of life is compromised, and it is a huge cost that you have to pay in terms of complications.
So another very important question has come. The people who are working in this present scenario. I'm working in shift duties and now I am in my night duty, and I have been recently diagnosed with diabetes. How to manage the things, sir?
You have to consult your physician. We need to see, full, it is not just you have become diabetic and you can have a random treatment started. Diabetes means we have to see what is the age, what is the body weight, what is your overall body mass index, what is your family history, do you have any other disease like hypertension, blood pressure, or cholesterol levels, or you have already some complication which has started. How long have your diagnosis of diabetes been made? Is it 6 months or 6 years? Have you ever taken treatment for diabetes previously? What are the current sugar levels? What is the A1C level? What is your kidney function, liver function, thyroid function? So many things we have to assess before we put you on a proper treatment. So it is not just simple thing that I've got diabetes, how should I manage? It is, one should always consult a proper physician and get a proper, comprehensive treatment for diabetes. Should not be just like, haphazard or a random therapy that you start.
So if we talk about the timings of these patients, don't you think it's really difficult to manage the things ki din raat hai, raat din hai for these people?
No, so see, this lifestyle has come here to stay. There are a lot of people working during night, so their eating pattern has to be shifted to that form of lifestyle. They have to take the breakfast in the evening, lunch during night, and dinner during early morning, whatever. And your meal distribution has to be done accordingly. Then you have to work out exercise time, which has to be done accordingly. then you have to see, that this person, what is going to be the action profile of the medications that we are using. Accordingly, everything has to be balanced out. But problem is that person thinks that, I've got diabetes, I will take one tablet and my sugar will be all right and everything is fine. So that approach is wrong.
Basically, you have to adhere to your lifestyle changes,
Lifestyle, everything, and you have to
exercise,
be
diet.
under medical supervision.
Yes.
There is, there is no way that you can do without a proper medical advice. It becomes risky.
And definitely this day-night difference, it will be an hindrance, but you have to
Yeah.
overcome it.
We have patients who are, working in night shifts, and we are managing them, and they are comfortably placed. Everything is possible, but consult a proper physician or medical setup to have a proper treatment.
So actually, what we see is what makes diabetes interesting and little different is not only the patients, but the family, the friends who are with the patients, they are also affected by this disease.
Yes.
So another very important part is why is diabetes rising in our country? This was a question it came up to me.
So, we have so many studies. The worldwide increase in diabetes is basically caused by two important changes that happened during last 4 decades. One is the increasing availability of transportation and mechanization, leading to decreased physical activity in all forms, whether it is, sitting at home, you are using remotes, you are using remote for every single thing, whether it is going to local grocery shop, whether people were walking earlier, now they drive. Your, transportation to any place has become easily available and physical activity is decreasing. So these are the two key factors that are leading to increased prevalence of diabetes in India or worldwide. Another important thing is that India is a country which came out of poverty. So there is something called intrauterine programming of the baby or the fetus, which happens when the baby is in mother's womb. And this is called uh, prenatal programming or intranatal programming. So India, we know, had a lot of poverty. Now we are moving towards affluence. So women who have been undernourished during pregnancy, their babies are programmed to achieve a catch-up growth during childhood and adult life, and they have higher degree of insulin resistance right from the birth, and they are more predisposed to diabetes. Similarly, women who are overweight or obese, again, their children are more prone to get diabetes in early stage and adult life. So all these factors are contributing to development of diabetes. Second thing is the increased availability of food, not junk food, just food. People are getting more food to eat. That is one of the things. Earlier, people were starving for food. Now, when we people talk of, the people who are eating junk food are more likely to get diabetes. So we should always keep in mind that we have enough Indian junk foods which people eat, which include samosas, chola bhaturas, and whatnot. So we consider only burger and pizza as junk food, and we don't consider these things as junk food. There is hardly any household in India where puri is not made or pakoda is not made. So this is also junk food. So excess consumption of calories with increased physical activity and predisposition to get diabetes, these are all factors contributing to increased diabetes prevalence.
Namkeen, which we eat on regular
Yeah.
basis.
Everything is fried.
The next question which has come is, does alcohol in minimal quantity interacts with metformin and be not taken at all?
Small amounts less than 45 ml are unlikely to interact with metformin, can be taken, but one has to keep in mind that alcohol is a hepatic suppressant. It suppresses hepatic glucose production, so does metformin. So person can go towards hypoglycemic range or hypoglycemia. So a person who is on metformin taking one drink must make sure that is taking adequate food also, or maybe a glass of juice or something sugary drink to make sure that during night hypo does not happen.
Sir, another very important point which I want you to focus on is diabetes a wake-up call? Is it the time to take care of your health?
See, I don't think why somebody should have get a wake up call to take care of health. If you are careful about your health, good chance that you will never need a wake up call. But certainly once you get diabetes, you should certainly understand that there is something strongly wrong with the lifestyle. Definitely, I'm not saying that everything is because of lifestyle. There are types of diabetes which will happen without lifestyle, being wrong. But there will be people who have very high, a very good lifestyle, and still they will get diabetes. But largely, yes, lifestyle has to be improved. Regular physical activity, and maintaining a normal body weight, and eating, judiciously can keep you off diabetes in general. But still somebody can get diabetes if there is a strong genetic predisposition, or there is a viral infection damaging in pancreas or pancreatitis, and so many things can happen. But generally, yes, person can get diabetes if the lifestyle is not good. Now once you get diabetes, it becomes like a it becomes something which is mandatory, or it's like person gets now ordered to follow this. If they are not following, they will not be able to take care of diabetes. So it is like policeman now with you, that you have to change it.
Very true, sir. Sir, I don't have any other questions with me. If you have anything else to say,
No, I think we have covered most of the things relating to understanding of diabetes. Do we have something on Facebook page?
Sir, I have taken the questions from there.
You have taken all the questions?
Yes.
So yeah, I think we can with this come to end of this session. And if there are more questions, we'll answer on the Facebook page only, as we have been doing earlier. Shailendra, you want to say anything, add anything here?
Sir, I'd like to say something today.
Yeah, sure. Why not?
Sir, I'll just say one thing. Managing diabetes is not only a science, it's an art. And sir, I've learned that. I'm trying to learn it from you.
I don't know whether I have learned it or no so far. I am still learning. But yes, we must do everything, to make sure that quality of life for diabetes patients is good. They are able to live as normal life as possible despite having diabetes. And that should be the purpose of treatment.
Sir, today's incidents I would like to share with my audience today with the patient. You were having a counseling session with the patient basically, and I overheard it about दुनिया बदल नहीं जाएगी. Please, आज आप बता दीजिए.
So see, as I mentioned, everything has to be in moderation. What happens is, this patient is a diabetic patient who was having a poor glucose control, and in 4 years time, for the first time, this gentleman has been subjected to full set of investigations. And in the reports now we are seeing microalbuminuria. So that means already kidney has got hit. Now, what stage it is, we have to evaluate. So the wife and husband both were total panic, now what will happen to this? So I had to, make them understand, fine, whatever has happened, we cannot undo whatever has happened, but we can still take charge of the things and improve things in due course of time. And we have now medications who can slow down the decline of kidney function, who can protect heart, the drugs which can protect heart or slow down kidney. And you have to have a positive attitude. People don't die of diabetes alone. It's easy. There are more chances that one will die of an accident or some random thing than diabetes. Diabetes, if you leave it untreated, is going to cripple your life, make your life miserable. If you treat it well, you can live practically normal life despite having all these things, and you can have a decent long life. There is no reason the life expectancy will be, shortened if you are treating it properly. And that is what I was explaining. I said nothing has happened. And, she was now, I have started giving him some kada, some green tea, some, all other things. I said, why are you giving all these? If he likes that, give him. Otherwise, there is no need. We need to focus on moderation, not to go on this extreme or that extreme. Now, whatever kala you are giving, we don't know how much salt load you are putting on kidney unnecessarily. We have to make sure that we don't end up in things which we don't understand. Best is to stick to the standard principles, live in moderation, make sure your sugar levels are checked regularly and they are in target range. Make sure you get all your investigations on annual basis. Whatever is the recommended, if it is recommended at 6 months, you get it at 6 months. Take your medications on time and follow the, your physician's advice. That is what is required.
So, sir,
So there
can
is no
I?
need to panic.
Yes. So we cannot stop the waves, but we can learn to surf.
Yeah.
Thank you, sir. Thanks a lot.
Thank you. Thank you everyone for joining.
Thank you very
Salil?
much, Dr. Makkad. And it was really a nice session, and especially I would like to thank you for making it live on Facebook, because as I can see Dr. Kirti Suta have taken so many questions from there.
Yes.
So
Yes.
really it was new for us also, because earlier we are doing only Zoom meetings, but you have shown us a new way to spread the knowledge information with the patients, sir. Thank you very much.
Thank you. With this, we end this session. And
Thank you.
next Thursday, we'll be on Facebook Live again
Yeah.
with yet another session. And I hope more and more people will join us.
Yeah.
Thank you.
Thank you, Doctor. Thank you.